Before we begin to examine the major areas of health informatics, we must first understand precisely what health informatics is, why it is important, and how it is related to data visualization and analytics. Let's start with what is health informatics. Health informatics is the use of technology and systems to collect, analyze, transmit, and share health information with the goal of improving quality of care, reducing costs, and engaging patients. Really, it is about the collection and management of health information. The systems and technologies you will be learning about are used every day by doctors, nurses, lab technicians, radiologists, healthcare administrators, and even government entities across the globe to collect and manage health information. One major item we'll talk about is the electronic health record, or EHR. Healthcare informatics workers sometimes come from a non-clinical or IT background and then learn clinical workflows in order to implement and support healthcare IT systems. Or sometimes health informatics professionals will come from a clinical background such as a nurse, lab technician, or even physicians and then learn the needed IT skills to work in the informatics field. So why is health informatics important? Now that you have a high-level understanding of what health informatics actually is, let's talk for a few moments about why it is important. As I alluded to previously, health informatics has the potential to improve quality and patient outcomes, reduce costs, and engage patients. Quality and outcomes improvement comes from the clinical decision support capabilities as well as other clinical alerts that are able to be generated within the systems in real time. This includes the reduction of medication errors by way of interaction and allergy checking, the ability to trend measurements over time such as height, weight, lab values, or other vital signs can help medical providers identify anomalies or concerns that might otherwise be missed when tracking such information on paper. We will discuss these clinical decision support capabilities more in depth in later modules. Cost reduction is another key benefit of health informatics. Prior to the wide adoption of health IT tools such as EHR and the ability to share data across systems, duplicate diagnostic tests were common. For example, a patient visits their primary care physician, or PCP, and had a complete metabolic panel and MRI ordered to determine the cause of their illness. Then the patient was referred to a specialist for further review. Oftentimes, a specialist might reorder the exact same tests if for some reason the results of the first set were not faxed to his or her office from the PCP, lab, or radiology group. This is just one example of duplication. But as you can imagine, when practices were documenting on all paper or even in siloed clinical systems, collecting and sharing data effectively was significantly more difficult than it is today, with full electronic documentation systems that are connected through health information exchanges, or HIEs. Patient engagement and enhanced communication is another key product of health informatics. Health informatics allows doctors and hospitals to share clinical information and educational materials with patients via patient portals. This information empowers the patient to be part of their own care as a key component of preventative health, which can have significant impact on reduction of healthcare costs. Patient portals also allow patients to securely send messages to their doctor. Lastly, the accurate and consistent collection of structured clinical information creates the foundation of data for which data analysis and visualization can occur. That is to say, that health informatics is the entry point of data collection that can then be analyzed and visualized to further meet organizational goals, improve outcomes, and reduce costs. In Module 3 and 4, you will learn about analytics and visualization tools and strategies. Gathering this data starts with health informatics.